So my education post high school began at Marietta College. I did a 4-year Bachelor of Science degree in biology there. After college, I went straight into medical school at Wright State University in Dayton, Ohio. Been 4 years of training there. And then from there, I went to Ohio State University in Columbus, where I did 3 years of internal medicine training. My favorite part about being a doctor is the relationships with patients that that position as a doctor affords you to have. It's one of the major reasons I went on to do primary care in the outpatient setting, is because you get to see the same patients over and over again, really understand them and understand their needs. I decided to come to Zanesville because it's actually my hometown. I was born and raised here. My dad is a physician in town as well, and growing up, I loved the area. I loved the education I got, the friends that I made, and as I kind of went out and did all my training in different cities and different places around the state, I realized how much I enjoyed being in my hometown, and decided when I was done that I wanted to come back there to practice medicine. Something that's very important to me as a healthcare provider is making sure patients get their lab results and imaging tests and recommendations regarding their health back in a timely manner. I think we all kind of know what it's like to wait on tests and wait on important information, and I put a large value on making sure I get that information back to patients as soon as possible, that I've reviewed their lab results, that this was okay or this was abnormal. I even try to set aside a little bit of time every night after office hours, making sure I go through kind of the messages from the day, the lab results, to make sure that things are getting back as quickly as possible, because it's frustrating to wait on that information. Obviously, my dad being a primary care physician here in town, I had a lot of exposure as a child to medicine, to being in doctor's offices, to coming to visit him at the hospital in the lounge. And one of my first jobs was actually working at the office in medical records, whether that was shredding old medical documents or filing papers. I always kind of had this idea that I liked that job. I thought it was an interesting job, but I wasn't sure exactly what I wanted to do. I knew I wanted to do something in science. I would say it was later on in my career, once I started going to college and really thinking about what I wanted to do with my life, that I realized medicine really fit with my personality and what my interests were and what I wanted out of a career. I do think it's important to get to know a patient on a personal level. That was one of the big driving forces of me doing primary care as my specialty, primary care and internal medicine, because the relationships you get to build with patients over the period of time was what really drew me into medicine. And getting to know your patient, how their personal lives are involved with their health problems, whether that's if that puts them at risk for other problems, or whether that's barriers to dealing with their current problems. I think it's really important to find out kind of what's going on behind the scenes too, because that can have a major impact on your health, and what we can do to help with those.